Romosozumab is a drug which has recently been approved by NICE for use in patients with severe osteoporosis. It is different to the standard medications in that it builds new bone and is effective for patients who have severe osteoporosis. So it is administered as a monthly injection for 12 months. And at the end of the 12 months, patients would then switch over to standard therapies. The reason for doing this is that the romosozumab builds new bone, and then the standard treatments maintain the bone that the romosozumab has built, and that reduces your risk of fracture more than just being on standard treatment. In line with the NICE guidance, people who have a high risk of having a further fracture in the following year to 18 months, and that is people who've had a fracture of their vertebrae or backbone, or their hip, or their humerus or wrist fracture. Those people are at a five-fold increased risk of a further fracture in the following 18 months or so, and should be considered for romosozumab. It is a generally safe drug. There are some side effects, and the side effects which cause people most concern is that it slightly increases your risk of having a heart attack or a stroke. So people who have a history, who have had a heart attack or a stroke in the past, shouldn't have romosozumab unless their risk of having a fracture are greater than their risk of having a heart attack or a stroke. Okay, so the treatments for osteoporosis are separated into two main classes: the anti-resorptive agents, such as alendronic acid and denosumab, and we now have two anabolic agents, teriparatide, which has been around for a number of years, and romosozumab, which has been recently approved by NICE. The teriparatide and romosozumab are anabolic agents which build new bone. So the benefits of romosozumab is that it builds new bone. It therefore makes your bone stronger and reduces your risk of having a further fracture. And as we know, osteoporosis can be quite a debilitating illness. It will cause people to be less able to do things for themselves. So it's important to try and prevent fractures and the debility caused by osteoporosis.